Great. So hi, I'm Joanna Shu. I'm co-founder and CEO of Freezenit, and we're developing a fast, non-toxic treatment for head lice that uses only cold CO2 gas. I'm a mom of 3 kids, and they've all had head lice more than once, and it's very difficult to treat. But it's really common. About 1 in 3 kids will get head lice at some point, which translates into around 17 million cases per year, and the result is 24 million missed days of school and work. So the ripple effect from one tiny bug is huge. Kids miss school, they fall behind. Parents miss work, meaning lost wages and productivity. And all that adds up to an $8 billion annual cost to our economy. And why the 24 million missed days of school and work? That's the policy at many schools. You can't return until the lice and eggs are totally gone. And that's not easy to do because current lice treatments are pretty terrible, usually involving pesticides, hours of tedious combing, or lots of messy creams. They're also ineffective. Lice have developed resistance to most of the popular products available on the shelf. And that's why we developed Freezenit, because we think we can do better. Freezenit kills head lice and nits in one short treatment without any harsh chemicals. So no mess, no prescriptions, and no combing. It works even on Superlice, and it's done in under 15 minutes. So we've spoken with hundreds of parents, dozens of doctors and nurses, and gotten tremendous feedback on our solution. Our goal is to get kids treated quickly so they can get back to learning and parents can get back to earning. So we have a proof of concept device, which works by filling a bonnet worn on the patient's head with only cold CO2 gas, the same gas that bubbles your soda. The cold gas simultaneously freezes and asphyxiates the head lice and nits in a single treatment. So we've conducted in vitro testing on lice to determine our percent of CO2 and temperature parameters. It gets to about 14 degrees Fahrenheit. So that's chilly, but most importantly, safe for children. And to put that temperature into perspective, chemo patients who are undergoing a cold capping to keep their hair during treatment, that's minus 35 degrees Fahrenheit for 6 to 8 hours. So as our treatment's much warmer, much shorter duration, we don't anticipate any negative side effects on the hair or scalp. And this just shows why Freezenit is so important, because it cuts days off the treatment time and it stops the spread before you walk back in the door. So our competitors fall short for several reasons. First-line treatments recommended by the CDC are permethrin-based OTC creams. So of those, Nix is the market leader. It's available everywhere, but it no longer works on Superlice. It's also banned in many countries, including the EU. Dimethicone-based serums, that's considered first-line treatment in Europe, takes up to 5 separate applications along with long combing sessions. It's also very messy when compared to the texture of motor oil. And so when these first-line treatments fail, and they do in over 50% of cases, that's when parents usually get outside help. So they'll either call their doctor, and their doctor will either write them a prescription or refer them to a lice salon. So prescriptions are effective, but expensive and can cause skin and eye irritation. And lice salons are expensive and time-consuming. So the size of this market is significant. An estimated 5.2% of the US population is positive for lice or nits at any given time. So the American Academy of Pediatrics estimates that $500 million was spent on OTC creams in 2022. And we think we can capture 10% of that market in relatively short order. Our beachhead market is the Dallas-Fort Worth area, which is the #3 area in the country for density of urgent cares, and the second largest school district in the state of Texas. It's also where our clinical advisory panel is located. So we plan to bring this product to market as a service, available at urgent cares, doctor's offices, pharmacies, and health clinics. In terms of the value prop, for parents, it's pretty clear, right? We're taking that burden off of mom and dad's shoulders. But for clinical practices, for our business customers, this Freezenit means additional on-site service revenue that in the beginning will be cash pay. So our go-to-market strategy is well-worn in healthcare. We're not reinventing the wheel here by any means. Medical practices are very familiar with the model of an upfront cost for a device plus disposables. Parents are already going to pharmacies, pediatricians, and urgent cares for lice. And now with Freezenit, these clinical practices will be able to offer an on-site service instead of writing a prescription or referring the patient out. And so a chance to increase the revenue. Although we don't normally think of doctors as small business owners in this country, they most certainly are, and are always looking for differentiators and ways to increase cash pay revenue. So each location would have a one-time purchase of a base device, and each patient or customer would be treated using a single-use bonnet and a CO2 gas cartridge in a razor blade model. Treatments done in a private area, like an exam room, takes less than 15 minutes. And after that, you go home lice-free with no special shampoos, creams, or combing needed. We have 2 pilot sites who signed letters of intent to test our next generation bonnet and base device. We've also begun initial discussions with APDI, the Alliance for Pediatric Device Innovation, for a larger clinical study to be designed and run out of Children's National Hospital in Washington, D.C. And where we are today, we filed an international patent application through the PCT. It also covers additional uses of the technology that we're not exploring right now, but I do want to plant the seed for migraines and for bed bugs. We just received back the preliminary search report on our patent application, indicating the USPTO finds our claims to be patentable. So it's only the first step, but it's very good news. We've raised $90,000 to date in cash, $15,000 of that being non-dilutive, and an additional $20,000 in in-kind services. We're also a finalist for the Mass Innovation Network Eddy Award, and we won Audience Choice recently at the Women's Fast Pitch semifinals. I'm not even allowed to announce it yet, but I'm going to anyway. We just got into the Mass Challenge early stage program. And so we're working on version 2 of our CO2 injection system, which we can then use to begin our pilots that I just spoke about, finalize device design, and begin production. So we anticipate classification as a Class 1 medical device, with the FDA filing a 510(k). So to put that into perspective, if you're not as familiar with the classifications, Band-Aids and tongue depressors are Class 1 devices. And so this is why we're the team to do it. My background is in developing better for you consumer products and bringing them to market. I founded my own skincare company, Refresh Skin Therapy, and got our products distribution in major retailers worldwide, such as Walmart, Costco, Sam's Club, and Rite Aid. My co-founder, Dr. Carol Spangler-Vaughn, has been in the life science research field for decades, with a focus on developing cancer treatments, and our IP comes directly from her research. So these are revenue projections based on a 2026 early launch and rolling out into one major chain per year, and whether that's urgent care or pharmacy. So we're raising $500,000 right now in funding, and that will get us to a final design, our clinical proof in humans, and completed regulatory filings. So this is a very simple device with a quick path to market, and we anticipate only one additional funding round to fund a larger North America rollout, which means limited dilution for early investors. So in short, Freezenit will improve treatment for the millions of children who get head lice each year. And if you don't remember anything else about me, remember that Freezenit kills head lice and nits in one short treatment with no harsh chemicals. Thank you.